So when discussing the various approaches available for total hip arthroplasty, it's important to consider both the surgical technique benefits as well as the patient recovery benefits. So this is how I would describe each of those. First, what are the surgical technique benefits from a direct anterior approach? Number one, it's a muscle sparing approach. We access the hip joint between the sartorius and the tensor fasciolata muscles rather than detaching them from bone. Number two, smaller incision and less soft tissue disruption. This leads to reduced intraoperative trauma. Number three, improved visualization. The supine position allows for real-time fluoroscopy during surgery to optimize implant placement, alignment, and leg length restoration. And number four, a lower dislocation risk. This approach preserves the posterior capsule and the short external rotators, reducing instability and the risk of post-operative hip dislocation. So next, what are the patient recovery benefits from a direct anterior approach? The first is less post-operative pain because major muscles aren't being cut. Patients often experience reduced pain and require fewer post-operative narcotics. The second is a faster functional recovery, earlier mobilization, often walking within a few hours of surgery. Third is a shorter hospital stay. Most patients are discharged within 24 hours, with many leaving the hospital the same day as their surgery. Fourth is a quicker return to normal activities. Patients often regain strength and mobility sooner than the more traditional approaches. Fifth is improved cosmetic outcome. We use a smaller incision with reduced postoperative scarring. And finally, sixth is a lower risk of a postoperative limp. The muscle preservation technique supports a more natural gait pattern early in a patient's recovery. If you're considering a total hip replacement surgery, definitely ask your surgeon about the direct anterior approach. We'll see you soon.